It is normal for patients to experience increased salivary flow when they start using the silencer. This problem will usually subside after the first few days of use. Unpleasant taste can be caused by poor home care. A better cleaning regimen can cure this problem. Non-compliance is another issue and usually requires counseling and consultation with the patient's physician. It is important that the patient fully understand the health risks posed by OSA. Please remember that snoring and sleep apnea are medical conditions. It is important that your silencer therapy be delivered in consultation with the patient's physician.
There were times when she'd have to poke me to see if I was still breathing, because I did have an indication of sleep apnea where I'd actually cease breathing, and I wasn't aware of this.
And I would lay there and I'd count 1, 2, 3, 4, and then I'd go and punch him sort of to see if he was going to be breathing again. And of course he'd go like this and he'd start breathing right away.
The cessation of breathing, I believe, hastened my heart problems. Certainly I was very young. I was only 46 when I had the double bypass operation.
We discovered I was unable to stay awake for any length of time during daytime, which was had some embarrassing features to it, particularly when you're working in an office. I'd fall asleep while I was talking on the telephone, or I'd be dictating a letter and I found myself falling asleep in front of my secretary.
The noise level of sleeping with a snorer, someone like my husband, makes it impossible. It's almost as loud as a pneumatic drill when your head is that close to someone else's on a pillow.
Well, my motivation for seeking treatment was that I started to develop a fairly significant snoring problem. Wasn't as much a problem for me as it was for my wife. You know, she would constantly have to wake me during the night in order for her to be able to sleep. And it started off just an occasional once a week, once every couple of weeks. And as time went along, I became a much more regular snorer, and so I started looking for answers.
The symptoms I had that were most troubling were falling asleep at night and waking to gasp for air, or not being able to fall asleep and seeming to need air, having to actually sit right up in bed or sit over the edge of the bed. A terrific amount of nighttime breathing problems.
The most problematic symptom that I had with my snoring and sleep apnea problem was morning headaches. I used to wake up in the morning and have a headache, and as a matter of fact, in the course of the night I'd have a headache. I'd wake up in the morning and I would have this headache, which would last an hour or two after I got up, and then it would disappear.
I went to my family doctor. My family doctor referred me to the University of British Columbia Sleep Disorder Clinic, and there they wired me up with bells and whistles all over my body and tested me out, and they just couldn't believe the horrendous noise that was coming through and the severe sleep apnea I had.
She took my blood pressure and she just calmly read it was 122/82 and 124/80 and wrote it down. And I thought, gee, that's great. And it was some time later before I realized that in nearly 20 years, my blood pressure had never read out at that level.
It was just as different as day and night. It was like one night I didn't get any sleep, and the next night, I mean, I actually didn't get any sleep either because I stayed awake waiting for it to happen, and it didn't happen. It was absolutely amazing, absolutely amazing.
Since I've been wearing a silencer appliance, because I have stopped the sensation of breathing and I'm breathing normally while I'm sleeping all night, I wake up much fresher in the morning, and I don't have that grogginess, I don't have the dry throat anymore, the sore throat. I just feel like a different person in the morning.
When he started wearing the silencer, his results were immediate. I know not everybody's are, but his worked that night. And it was such an unbelievable thing to hear silence that I stayed awake listening to the silence.
Well, the silencer has made a complete change in my life. It's opened all of the vistas I used to have before. I no longer have the tired feeling. I sleep well.
Once I had the silencer appliance, I found that my sleep did improve, though. And I found that, in fact, where I didn't know that I was tired during the day. In fact, I really was. I was much more rested after wearing the silencer.
The effect of the silencer has slowly but surely been wonderful. I think between the two, for the jaw movement, for the ease of knowing the jaw moves, for being aware now that, especially when I go to bed and when I wake up, that I am actually breathing. It is actually now full breathing all the way through, and there are times I actually just like to lay and do nothing but breathe. It feels so good.
As far as I'm concerned, it's something that everyone should, who snores and has a problem where it's creating difficulties either personally or with their mates, they should really look into this.
Instead of stopping breathing 350 times pre-operation to 250 times post-operation, I'm down to 3 times in one 7-hour period. My oxygen level's gone from, it was a low of 14% all the way up to 96%. My heart rate was 122 at its worst, and now my heart rate, I'm in the 60s when I'm sleeping. Major, major differences.
Since I've had the opportunity to introduce this appliance to patients in my practice, one of the things that I particularly noted is that they have responded positively because they feel that I've contributed dramatically to improving their quality of life.